Hello, and welcome to the Alabama Public Health Training Network. I'm Brandon Vaughn with the Alabama Department of Public Health. Thank you for joining us today for our program, Tele-Behavioral Health, Clinical Evidence-Based Interventions. If you have a question about anything being discussed today, please call or email during our broadcast. The phone number and email address are on your screen now and will appear again later in the program. Also, the handouts, sign-in sheet, and evaluation are available online. You will need to register for this program in order to access those materials. Continuing education credits have been approved for nurses and social workers for this program. In order to receive credit for this training, you must watch the entire program, then complete and return the sign-in sheet and evaluation. While content may continue to be relevant, CE credit will only be awarded for 2 years for nurses and social workers, expiring December 31st, 2021. If you are watching this program on demand and want to receive a social work CE certificate, you will need to complete the social work test and send it in, along with your sign-in sheet and evaluation. If you're watching this program live, there is no social work test required. For social workers, if you're watching this program live, it qualifies for classroom hours. If you're watching on demand, it is considered non-classroom hours. Before we get started, I'd like to introduce our presenter today, Elena M. Parker Merriweather, Director of Behavioral Health for Medical Advocacy and Outreach's Copeland Care Clinic. Welcome, Elena. Cover today, so let's go ahead and get started with your presentation.
Well, thank you so much. And first of all, just want to thank you again for the opportunity to come and share information with you about telebehavioral health, and just want to extend an apology for the technical difficulties that occurred in our initial attempt. So we're hopeful that we can proceed and move forward, and thank you for those who have, thank you for your patience for those of you who have remained tuned in for the program. So, moving forward, as we look at telebehavioral health, clinical and evidence-based interventions, we want to talk just a little bit about what it means to provide clinical services utilizing evidence-based interventions with using different types of telebehavioral health medians. So, being that this is part 3 of a series, we first want to just go over some of our objectives and let you know a little bit about what we're going to discuss in our program today. So, first of all, we want to do a little bit in terms of reviewing risk management considerations that can be used when providing telebehavioral health services as it relates to the different types of medians as well as modalities. Another objective that we will look at is how to looking at different assessment tools that can be used for substance abuse as well as mental health services. We will talk a little bit about different types of therapeutic interventions that can be used when providing distance services to our constituents. And we'll also talk a little bit about different types of risk management considerations as it relates to working with people who are experiencing crisis and emergency situations. So, before we move forward, we're going to just do a quick overview in the next several slides to bring everyone up to speed on the information that we discussed in our Part 1 and Part 2 telebehavioral health programs. So we want everyone to kind of make sure everyone is aware of some of the different elements that we talked about as it relates to technology, administrative concerns, as well as programmatic concerns. So one thing that we want to encourage everyone to do, because we know that we have multiple different types of disciplines that are viewing this program. So we want to encourage you to think about this from the respect of the various agencies that you specifically work for, but also the discipline that you represent. And one reason we mention that is because as we go through the discussion for this program, I will often use the terms patient or client interchangeably. And the reason I say that is because we are in a health department setting, and we of course serve patients. But we may also have someone that works in a community setting, and they might work with clients, or someone from a school or academic setting that actually works with students. We might have someone that works in a law enforcement or a correctional capacity, and they might work with incarcerated individuals. So we want you to think about your respective agency and the constituents that you work with as we transition through our topic today. And think about how this specifically applies to the individuals that you work with. So, first and foremost, one thing that we did some extensive review on in our previous program was the different types of telebehavioral health medians. Now, this is actually the method in which services are actually delivered and provided. This is the manual method. And so people utilize different types of medians based on their experience as well as their different comfort level. So I'm going to mention just a few of these for consideration for individuals who are considering or currently providing different types of distance services. So the most common medians that are used are, of course, a desktop. You also have a laptop, a tablet, as well as a cell phone. So one thing that we mentioned in the prior program was that all telebehavioral health sessions should first be implemented through a face-to-face, in-person interaction, okay? And when you have that face-to-face, in-person interaction, that is an opportunity for the provider as well as the constituent to have an in-depth conversation about what telebehavioral health services are, okay, as well as the different medians. And one reason that that conversation is important is because a median needs to be selected based on the experience as well as the comfort level of both the provider as well as the recipient, okay? So in having those conversations in that initial face-to-face session, one thing to also consider is all of the different risk management issues that come along with that. So I want to briefly talk a little bit about those considerations just as a quick review. So when the median of a laptop, a desktop, or a tablet is being utilized, you want to always make sure that those devices are protected with a unique password so that no one can access that device who's not supposed to be accessing the device. Also making sure that firewalls as well as the Norton antivirus program is installed on the device to protect it from any type of outside invasion or intervention on the device, but also just kind of reminding people about the importance of not sharing a device when you're currently logged in to any type of other counseling software, okay? So, and I want to kind of stop and put a pin in that one for a minute, because depending on the median, depending on the method that is being used, you can have telehealth programs that are used for the delivery of services, but you can also have a separate counseling, behavioral health counseling software program that's used as well. It is a good idea to identify programs that are all-inclusive, okay? Programs that have both the tele-behavioral health component, but also the counseling software component within the same program. So when you're looking at different programs, those are some things you might want to think about and consider. But in addition to that, making sure that whatever device is being utilized, it is initially set up for routine and automatic updates. So when you're looking at a desktop or a laptop or a tablet, these are some things that we often have to be mindful and take into consideration, especially when we're providing distance services. I want to talk very briefly about the use of a cell phone in the provision of telebehavioral health services. So oftentimes the question may come up around, is it okay to use my personal cell phone? Well, it's never okay to use your personal cell phone, okay? So it's always a good idea to to be familiar with your agency's administrative and communication and technology policies around the use of cell phones when providing services to constituents in the community. So oftentimes you have many agencies that will provide a work cell phone to their staff who have to have patient or client interaction. And oftentimes those work cell phones or work laptops, work-related devices are often programmed by IT with consideration to all of the different types of technology issues that come along with that. And we'll talk a little bit about those technology considerations in the next slide. So you want to make sure that when a cell phone is being utilized, no client information is stored in that cell phone, but also making sure that that device is protected with a unique code, a swipe, or a password. And that actually limits access from someone who could just pick your cell phone up and utilize it without consent. So another component to consider is the use of security software when setting up your device for telebehavioral health services, and making sure that it does automatic updates on the device. Now, we're referencing this as it relates to a cell phone, but it's something that needs to be taken into consideration with a desktop, a laptop, as well as a tablet. When we look at technology considerations, want to kind of delve into this just a little bit more in detail. This is something that you want to always make sure that you have consulted with an IT representative, someone from your IT department who can make sure that all of these different aspects of technology has been considered on whichever type of distance median is going to be used. So we're all familiar with HIPAA and the importance of protecting private patient information, maintaining the confidentiality of information, whether it is manual information that is being discussed, but also computer generated information. We just want to make sure that HIPAA is always referenced and everything is set up in such a way to protect the privacy of information. We also want to make sure that devices are encrypted to prevent any type of outside interferences. Considering bandwidth as well, and bandwidth is something that has to be checked into, especially when you're providing services to remote and rural locations of the state, because sometimes the bandwidth may not be as high as it needs to be in order for certain services to be provided. And when you're providing these services to individuals that live in very rural parts of the community, they may or may not be with the availability of bandwidth in their respective areas. So you want to have conversations about that because that could significantly impact connectivity issues that may or may not be known in that initial session. But also looking at firewalls to protect whatever device is being utilized. Looking also at the camera and the microphone on the device. And one thing that we mentioned in one of the previous programs is that you want to always be conscientious and mindful of the background of the camera, okay? Because of course you have the provider in camera view, but what's in the background, okay? And we want to make sure that whatever it is that's in the background, it is conducive and supportive of a healing environment, of a helpful environment, and the background does not display something that is contradictive of the service that's being provided. So those are some things that have to be taken into consideration, especially when it comes to the verbal element of communicating with someone. So we also have to look at computer security and what needs to be in place to protect information that is stored on the respective device, but also looking at being able to distinguish between equipment error versus user error. And that's something that's very important and should always be discussed in that initial face-to-face session. Having discussions around how to utilize whatever type of medium is going to be utilized, but making sure that both parties know how to utilize the equipment as well. So ongoing troubleshooting is very, very important. And once again, I want to re-emphasize the importance of having an IT staff person or a representative from your information technology department involved with the planning and the delivery and the implementation and the ongoing monitoring of the technology aspect of telebehavioral health services. So where are some of these services actually provided? We want to just list a couple of different places, a couple of different venues of where services are delivered. They might be delivered from a rural health clinic, or just some type of rural community-based organization. They might be delivered from a residential setting, and I want to just emphasize residential setting does not mean at the house, doesn't mean it's always at home. A residential setting could be a hospital setting, it could be an inpatient treatment facility, it could be a nursing home. There are many different types of residential settings, but I want to once again encourage each discipline to think about it as it relates to their respective agency or business where they provide services. Community agency settings, which I think is pretty clear. One which is very, very common is a military installation. People who are serving in the military, they are transient. They transfer around to different military installations on a regular basis, and sometimes they prefer to maintain their same service provider, even when they get deployed or they get relocated to a different location. So services are often telebehavioral health services are often provided for service individuals at different military installations. And then we also have detention centers as well as correctional facilities where you have providers who are in the community that link in and are able to provide different types of services to individuals who are detained in correctional environments. So we want to just always keep in mind all of the different technological issues that go along with service delivery at the different locations as it relates to the privacy component, confidentiality, and the safety of information that is being disclosed or transmitted. So once again, who are some of the different clinical disciplines? We talked about this a little bit in our last program, but I want to kind of review them, and there are a few that are not listed on this slide. So when we look at the different clinical disciplines that provide telebehavioral health services, keep in mind this is not an all-inclusive list, okay, because there are different providers that provide different services. But when we look at telebehavioral health services, we often see how therapists are involved in the delivery, social workers, alcohol and drug counselors, mental health therapists, psychiatrists, as well as psychiatric nurses and nurse practitioners. And we also want to add to this list individuals who are already listed that serve in a dual capacity, where they're providing their clinical service, but they might also be involved with administrative planning. They might also be involved in program management. Telebehavioral health is a program, okay, and there's several different components that are involved with that. So I want to make sure that we take into consideration individuals that do serve multiple roles and wear many, many, many different hats in providing services. So you also may look at case managers, but I also want to add linkage specialists, okay? And when we talk about linkage specialists, we look at those individuals that might fall into one of these different disciplines that also serve as navigators, where they're responsible for linking individuals to care. So an example of a linkage specialist might be, for example, a social worker who is working to engage people who are not receiving services into a medical program, to receiving HIV care services, receiving treatment services, or just linkages to an HIV medical specialty clinic, some type of Ryan White service organization, or a social service agency. We look at individuals who serve as community educators, community outreach workers, or community health advisors that work to identify people who are in active substance use addiction that are interested in receiving treatment but may not know how to navigate that process. So that's where we bring in those community outreach workers or peer support specialists that can support the transition from the community into a treatment-oriented environment. So we want to just encourage everyone to think about their respective roles, but also consider when there are other roles that go along with that, because even though we are pretty much focused on our respective discipline, we all tend to get involved with a multitude of other duties and tasks as well as relates to education and outreach. And as well as physicians, because we do have physicians as well as pharmacists. And we did mention about physicians and pharmacists and other medical specialties that utilize telehealth or telemental health or telepsychiatry, okay, as it relates to their own discipline. So we want to just make sure everyone is aware of the different services that are provided and how that is actually done. So now that we've looked at the different disciplines as well as giving consideration to other disciplines as well, what are some of the services that are provided by individuals that offer telebehavioral health services? We look at screenings and assessments, which we'll talk a little bit more about shortly. We look at the provision of patient, client, and provider consultations. We look at the provision of both individual as well as group therapy and different types of services that are offered through targeted case management and other types of case management services that are provided when we work with individuals that are in need of different types of services. But also the importance of looking at referrals and linkages to care. So these are some of the primary clinical services that are offered to people, but how do we provide this as it relates to telebehavioral health? We provide it utilizing the different mediums that we talked about earlier. Oftentimes, individuals who are in need of these different services are limited to receiving them face-to-face due to issues pertaining to access, due to transportation, due to a lack of service providers in a particular community. And that goes to the emphasis on, you know, the shortage of health professionals in different rural communities that are available to provide some of the different clinical services that are needed. And then sometimes we have people in the community that just don't know what's available and how to access the different services. So this can serve as a method to bridge some of the gaps and address some of the issues that go along with access to care. So moving forward, okay, so our other clinical considerations. One thing we talked a little bit about was making sure that we are accessing patients or clients for fit. And when we look at accessing for therapeutic fit, one thing that we have mentioned a couple of times throughout this discussion is the importance of all initial sessions being conducted face-to-face, okay? The initial face-to-face session is an opportunity for both the constituent as well as the provider to talk about what telebehavioral health means. It's an opportunity to receive consent. It's an opportunity to talk about all of the different risk factors that come along with it as it relates to privacy and confidentiality and all the HIPAA considerations. But also it's an opportunity to identify a method for verifying that both individuals are actually communicating with who they're supposed to communicate with. So that's one reason we talk about verifying the mutual identities when using different distance medians. And one thing that I did want to mention is when we look at verifying identity, that is something that occurs in the first face-to-face session, but also giving consideration to whether or not you want to use an identification card, okay, such as a driver's license, so that you can verify that you're speaking with who you're supposed to be speaking with. Sometimes it might be considering an agreed upon code that only the provider as well as the constituent they're aware of, and they know what that code is going to be, and that's how they identify and connect within the session through the use of that code. And all of that helps to protect the safety of the exchange through distance learning. Another consideration is determining the location of where services will be provided, so that the provider is speaking with the constituent in the mutually agreed upon location, okay? And I think one location that we mentioned in a previous conversation is making sure that whatever that location it is a safe and a secure location for distance services to actually be provided. So from a provider perspective, you want to always take into consideration and extend further dialogue and conversation when a constituent is preparing to receive services from their personal car, okay, a personal vehicle, because you want to make sure that there are safety considerations in place, but also making sure that the person is aware of potential risks for breach of confidentiality and privacy as a result of being inside of a car. So you want to have those conversations and also make an informed decision of when services do not need to be provided, even if it has been initially agreed upon. Okay, so you want to keep that into consideration. So looking at self-assessment, in the therapeutic culture, providers are always considered to self-assess, to check themselves, okay? Checking themselves to make sure that they are appropriate, they are experienced, they have been trained, and they are in a position to provide clinical services through the use of telebehavioral health medians. So one thing that we always encourage people to do is know yourself. Know how your respective style impacts the modality of the service that's being provided. You want to be very in tune and self-assess your preference as it relates to interacting with constituents via email, via telephone, via video conference, or if a face-to-face interaction is the best interaction. And one reason that we emphasize that is because each person, the provider as well as the constituent, they need to be comfortable with whatever the preferred method of delivery is. Another thing to also consider, and I want to combine these two together, is thinking about what is stored in your respective toolbox. What do you actually utilize to help clients or patients that you're working with? And one reason that we emphasize reflecting and self-checking what is actually in that toolbox is because that could have an impact on the type of median that is selected when providing different types of services. So an example of that is looking at some of the different types of therapy techniques that are utilized. For some individuals who provide clinical services, they like to utilize worksheets, okay? Providing worksheets as tools that can be used within a session, but also worksheets are sometimes given as homework assignments as well. You also look at the capacity to do role playing for people who are interested in role playing to help out with the therapeutic process. You also look at the concept of play therapy. Now, play therapy is usually a method that is done with children and adolescents and oftentimes older adults. However, it doesn't mean that it can't be done with individuals during middle age, the middle aspect of the lifespan. But what is the capacity to engage in play therapy utilizing telebehavioral health meetings? It may or may not be possible, but if that is a tool that is often used as a part of your therapy toolbox, that's something you have to take into consideration. Also, you have individuals that like to use sand tray. Okay, and when utilizing sand tray, how can the different supplies as well as the direction of the intervention occur utilizing sand tray? So it may or may not be the best method to utilize as it relates to provision of services. But we also look at the integration of art therapy. There are some individuals that integrate art as a form of therapeutic interventions, and also music therapy as well. So it's different for each individual provider. And so as a part of that self-assessment as a clinician, identifying what tools you like to use, what tools are most effective in that process, and how can that actually work when providing the different interventions. Okay, so moving forward, once we do that self-assessment, we have to continue to look at our clinical skills. And in looking at our clinical skills, one emphasis that we really want to make sure we talk a little bit about is the element of communication, okay? Communication and how we're able to foster engagement with the participant, with the constituent, whoever the person is that we're working with, because in order to provide an effective service, we have to be mutually engaged in the process. Distance services can impact the capacity to engage, but also the depth in which the engagement can occur. So just a couple of tips that you want to think about clinically when it comes to the provision of services. When we want to foster engagement, we want to be mindful of our voice tone. You want to avoid having a monotone voice when providing services, okay? So you want to make sure that there is some pitch considerations when communicating with individuals utilizing different methods. You also want to be mindful as it relates to pauses, okay? Pauses can be good. Pauses can also be a bit intimidating, depending upon the content, the context of the session, especially when there's a limited face-to-face interaction during that session. So you want to be conscientious of pauses so that if there is a pause, you're mindful of the time frame of the pause so that the pause does not extend to a place of discomfort for the person who is on the receiving end. So you want to be conscientious of pauses that go a little bit longer than a few seconds. So when looking at those different elements of fostering engagement, you want to be mindful of your responses, because responses need to vary from time to time depending on the content and the context, to just make sure that we're mutually engaged in the process, okay? So as it relates to the provider, you want to be very in tune with when responses are provided and the type of response that is provided, because it is up to that provider to maintain ongoing engagement from the recipient. One way to actually facilitate that process is to continue to ask for feedback, okay, throughout the process of the session, throughout the interaction, you want to ask for feedback because sometimes you want to be able to verify that both the provider as well as the constituent are at least on the same page, in the same chapter, in the same book, okay? And when there's a limited amount of face-to-face interaction, it compromises the capacity to observe nonverbal gestures, okay? So asking for feedback is an opportunity to clarify statements. It's an opportunity to probe further. It's an opportunity to minimize misunderstandings and misinterpretations, okay? So one critical element of fostering engagement is making sure that everyone understands information the way it is intended for it to be understood. So when we're asking clarifying questions, we want to be very specific as it relates to the emotional element that's involved. That's a part of that engagement component, because we want to make sure that when we're asking questions, we understand what the person is actually stating, what they're really feeling, but making sure that there's consistency with the emotion that's being expressed, but also the words that are being expressed as well. So that's something that's very important. We talked a little bit about nonverbals, so being in tune to different facial expressions as well as physical gestures that are made. And one reason that we emphasize that is because you want to be able to assess the consistency between what is actually being stated versus what is actually being observed, and making sure that everything is parallel and in sync with the other. All of that is very important when it comes to fostering engagement, but also the importance of practicing different communication skills with the use of body language as well, and having conversations about what that actually means. So now that we've talked a little bit about the different clinical skills and the different provider disciplines that offer the different telebehavioral health services, but also assessing ourselves to make sure that we are appropriate as clinicians to provide different types of telebehavioral health services. This allows us to transition into some different types of screenings as well as evidence-based interventions. So, as we talk about evidence-based interventions, I want to start with one intervention that has been integrated into many different types of primary care settings, specialty care settings, as well as behavioral health agencies, is SBIRT, S-B-I-R-T, which is pronounced SBIRT. And SBIRT stands for Screening for Brief Intervention and Referral to Treatment, okay? And this is an intervention that has been identified that can be utilized in pretty much any type of healthcare setting, a community provider setting, any type of setting, to be able to assess and identify if individuals who are receiving services have different types of behavioral health issues. So the textbook definition for SBIRT, it is an intervention-based practice used to identify, reduce, and prevent problematic use, abuse, and dependence on alcohol and illicit drugs. Now, SBIRT also integrates a mental health screening tool as well, okay? So I want to talk just a little bit about the different components of SBIRT, and then we'll talk about the screening tools that are utilized as well. So when we look at the different components of SBIRT, we look at the initial piece, which is the screening element. That is where a healthcare professional assesses a patient for risky substance use behaviors using standardized screening tools. Screening can occur in any type of healthcare setting, but I want to take it a little bit further. It can also occur in a community-based setting. It can occur in a rural clinical setting. It can occur in the health center of a university. So SBIRT screening can take place anywhere by an individual who has been trained on SBIRT and how to actually implement the intervention, but also how to follow through with it as well. So that is the initial component of SBIRT, the screening piece. We also look at the brief intervention component. That is where a provider actually engages the participant by showing them risky behaviors in a very short conversation where they provide feedback and advice, okay? And the intervention is always geared towards encouraging the recipient to think about behaviors that might need to be changed, identifying various risk behaviors that need to be modified, and inserting new behaviors in to reduce their risk factor for whatever that risky behavior is. So that is the brief intervention component of SBIRT. And then the final component includes the referral to treatment. And when we look at that referral to treatment, it could be a referral to brief therapy or some other type of treatment modality for patients that actually screen and need some additional types of services. So a couple of things we want to mention as it relates to SBIRT. For the purposes of this discussion, we're primarily referring to behavioral health services, such as substance use, such as mental health services. But one thing that I do want to mention is that there are other screening tools that can be integrated in as a part of that SBIRT. SBIRT is intended to be an initial screening for when an individual first meets with a medical provider to identify and assess what is actually taking place, so that as treatment services are planned from a holistic perspective to address all aspects of the patient's needs. So in looking at SBIRT, we consider some of the different screening tools that are actually utilized. And as we mentioned, SBIRT does screen for mental health issues utilizing the PHQ-9, known as the Patient Health Questionnaire. And the PHQ-9 is actually a 9-item depression scale that is used to assist primary care providers in identifying and diagnosing depression, as well as selecting and monitoring whatever type of subsequent treatment they actually receive, okay? So the PHQ-9 is just that initial tool that is used to screen for depression. We also look at the use of the audit, alcohol use detection inventory tool. Now, this is a method of screening participants to identify if they have any type of excessive drinking as the cause of whatever their initial illness is that brought them in to that particular provider. The audit tool provides a framework to help individuals that are engaged in excessive alcohol use to reduce or cease the consumption to avoid harmful consequences. So that audit is the tool to assess for excessive and dangerous alcohol use. We also look at utilizing the DAST. The DAST, of course, stands for Drug Abuse Screening Tool, and it was designed to provide a brief, self-reported instrument for population screening, clinical case finding, and treatment evaluation research. It is primarily used to assess individuals for excessive, dangerous, abusive drug use. It is very, very useful in working with young adults as well as adults and older adults as well. So that's just an example of one of the SBIRT assessment tools that is used as a part of the screening process. So when we look at different types of evidence-based interventions, because going back to a couple of previous slides, we look at brief intervention. Brief intervention is a key component of the SBIRT program. So in looking at evidence-based interventions, I want to talk just a little bit about some of those different evidence-based interventions that can be utilized as a part of distance learning and distance therapy services. We look at motivational interviewing. Motivational interviewing is an evidence-based intervention, and the method is intended to assist individuals with resolving ambivalent feelings as well as insecurities, to be able to find some type of internal motivation that's needed to adjust and modify different types of behaviors. It is considered to be a very practical, empathetic, and short-term intervention approach, which takes into consideration how difficult it is to modify behaviors, but sometimes in an effort to improve the quality of life, we have to look at changes that need to be made. So motivational interviewing is one evidence-based intervention that is used as a part of SBIRT. We also have to look at another intervention, solution-focused therapy. And when we look at solution-focused therapy, it is future-focused, it is goal-directed, and it is focused primarily on solutions rather than the problems that actually brought the person into therapy, okay? So I want to focus just a little bit on solution-focused therapy. So when we look at solution-focused therapy, it is intended to be brief, okay? It is intended to assist individuals with identifying how to set goals, how to actually set those goals based on SMART objectives, and focusing on the solution that's actually needed to address whatever the problem is. Solution-focused therapy most times occurs in only just a few therapeutic sessions, and it also is based on the amount of time that has been allocated to work with a particular individual. So an example of when solution-focused therapy might be provided, and I want to use the reference back to individuals who are in the military that might see a service provider, and that individual might utilize solution-focused therapy. Well, they utilize solution-focused therapy because they may only have one opportunity to meet with that individual to provide services. They may only have 3 to 5 sessions to meet with an individual. And we emphasize that one because individuals who are in a location for only a small period of time, they need something that's quick, they need something that is effective, and something that they can take with them even when they're no longer meeting with the service provider. So solution-focused therapy is a really good model, evidence-based model to consider when there is not an opportunity to work with the recipient for an extended period of time. Solution-focused therapy is often utilized as well when people have emergency situations or crisis situations where they need assistance with identifying an immediate solution that can actually work and assist them in working through whatever the situation is. So that's another example of an evidence-based intervention that's utilized with telebehavioral health services. Another component which I think everyone is very familiar with as it relates to evidence-based interventions, different types of cognitive behavioral therapy approaches. So when we look at the cognitive element, we look at just focusing on the mind, focusing on the brain, focusing on our thought processes. So when we look at cognitive behavioral therapy, it is a psychosocial intervention that focuses on challenging and changing unhelpful cognitive distortions and behaviors. Okay? How many of us have something that we think about that we don't need to be thinking about, or we need to just change how we think about certain things? We look at how to improve our emotional regulation. Sometimes we talk to children and adolescents about controlling their emotions, but as adults we need to think about, you know, how do we control our emotions, how do we control our behaviors so that we can generate different outcomes. So we look at improving emotional regulation, regulating those emotions, those feelings and those thoughts and those behaviors, but also the development of personal coping strategies that target solving current problems. So that cognitive behavioral component that is geared towards changing our thought processes, changing our behaviors, changing how we interact, changing how we behave so that we can work towards solving whatever some of those different issues are. So when we look at those cognitive-based approaches, it's all about reprogramming your mind. It's all about restructuring the thought process. It's all about challenging and changing that belief system. All of that can be done through the use of telebehavioral health services. So there are a multitude of different cognitive behavioral approaches that can be utilized, but we wanted to just kind of briefly talk a little bit about those and just mention it so that when you're providing services through telebehavioral health, you are aware of some of the different approaches that can be beneficial and effective to the participants that you're working with. So we want to kind of start moving forward and looking at crisis response, okay? Crisis response counseling. But before we talk about crisis response counseling, looking at those risk management considerations, okay? Risk management considerations. And a couple of things we want to make sure we emphasize as we have throughout the course of our telebehavioral health programs is that this is not intended for all providers. It's not intended for all patients or clients. It's not intended for everyone that we work with, but also as it relates to the different disciplines that are providing the services, it's not intended for everybody to provide crisis counseling. It's not intended for everyone to utilize distance methods when addressing individuals who are in crisis situations. So a couple of things we want to remember is that individuals who actually display signs of psychosis or serious mental illness, they're not appropriate for telebehavioral health services. You do not want to put them in a structure to have to utilize different methods of telebehavioral health for telebehavioral health services. So keep that in mind as it relates to individuals who display signs of psychosis or other serious mental illness. We also want to not put patients who are suicidal as a part of a telebehavioral health session, especially if it has been pre-identified that that individual has a plan of action, okay? And when we say plan of action, we're looking at, does that individual, have they disclosed when they're planning to attempt suicide? Have they disclosed a method? Have they disclosed where they're planning to do it? What are some of the factors that play into consideration when you're working with a suicidal patient? Those individuals are not appropriate for telebehavioral health services. So when you have those different factors that are taken into consideration and the person is displaying active or acute mental health issues, that might be a sign that they need to be referred to an in-person provider, and depending upon how acute it is, it might warrant contacting 911 immediately for some assistance and support. So wanted to mention those considerations when providing crisis counseling and who's not appropriate. So We want to next look at the implementation of emergency response counseling. And one program which I really just enjoy talking about, and if we had more time, I'd get more in detail about it, is psychological first aid. Psychological first aid is an evidence-based training that is utilized for individuals who are experiencing emergencies or disaster situations. So in looking at psychological first aid, it is an evidence-informed modular approach to assist children, adolescents, adults, and families in the immediate aftermath of an emergency. So oftentimes when you observe or notice some type of community emergency, something that you hear about on the news or something that you observe, what's often not mentioned is that you have those mental health first aid responders that show up. Those are our first responders that are trained to address the mental and emotional responses to an immediate emergency that has just occurred. And oftentimes those individuals are utilizing psychological first aid approaches. Psychological first aid is intended to reduce the initial distress, which is caused by traumatic events, and to also foster short-term and long-term adaptive functioning and coping following an event. So one thing I want to encourage people to kind of think a little bit more about is when we hear about different man-made events such as active shooter events or terrorist events that have occurred, or it might be a weather-related emergency such as a hurricane or a tsunami or something like that. You have those first responders that show up just to make sure that people are okay mentally and emotionally. And what is often not known to the public is that those individuals have been trained in psychological first aid, and they know how to implement the different core functions when working with someone who has survived an emergency or a disaster-related event. Another emergency counseling strategy that can be provided, which is also an evidence-based intervention, is critical incident stress management. Oftentimes you may hear about something that has happened in a school setting or a work-related setting, and you might hear on the news where we had therapists and counselors to come in and work with the students or to meet with the staff. What is often not disclosed is what they're providing is CISM, critical incident stress management. CISM is also an evidence-based program that is considered an adaptive, short-term psychological helping process that focuses solely on an immediate and identifiable problem. CISM can also include pre-incident preparedness to acute crisis management to also post-crisis follow-up. So when we look at the implementation of CISM as a part of a crisis-related event, one thing that has to be taken into consideration is the structure of that event. CISM can be provided through Tele-Behavioral Health Services. Oftentimes in rural communities, in rural settings, there's not always a health professional that can provide emergency counseling services on the scene at that respective venue. And so when you look at a rural community that has a shortage of health professionals that can come in and provide crisis response or crisis emergency services, they might have to utilize distance methods where that particular site might link and connect with a behavioral health organization and have a provider to provide different types of emergency intervention services. So just kind of wanted to share that because those are crisis-related programs that can be utilized, and they are evidence-based interventions. It's important that the providers of these services are appropriately trained so that they can maintain the fidelity of the program. Another intervention, which I did not list, is mental health first aid. Mental health first aid specifically provides crisis or counseling intervention services to people that have different types of mental health issues. So if you have an opportunity to participate in a mental health first aid training, it is a much more intensive training that addresses all of the different behavioral health components, such as people that might have substance use issues, people that might have diagnosed mental health issues, people that might have different types of functional and access needs, so that individuals, first responders, can tailor their intervention to be more effective when working with people that have different types of different needs. So as we kind of start wrapping up to some degree, we want to talk about terminating sessions. And when we've gone through the whole telebehavioral health component, we've done that face-to-face session, we want to gradually move towards the termination of those sessions. And the benefit of telebehavioral health services is that it allows for a gradual termination of services that can occur over the course of a period of time. So when we look at services that are provided through telebehavioral health from beginning to end, we look at how most initial face-to-face sessions, they're usually that introductory session, that getting to know you session, that building rapport session, that diagnostic session, that screening session to find out what's taking place with this person and what can we do to assist them. But one thing we want to remind everyone is about the importance of reviewing the telebehavioral health model of service delivery to make sure that we've talked about HIPAA, we've talked about emergencies, we've talked about risk management considerations, we've talked about all of the different technological issues that go along with that. So we want to make sure that at the very beginning, in that first 60-plus minute face-to-face session, we've had all of those conversations and we've talked about those key elements of providing distance services. We move to that 45-minute session, which may occur on a weekly basis for a month. We might even transition to a 30-minute session that occurs once a week for a month. And then eventually it might transition to a 15-minute session that occurs over the phone once a week, and then gradual termination. Okay, so this process from beginning to end could vary based on the agency's protocol. It could be based on the clinical diagnosis and what the recipient actually needs, but most importantly, it could also be based on the progression of meeting the initially stated goals of the session. So multiple factors will go into what takes place at from the very first face-to-face encounter, but also to the session of termination as well. So in that final session, and as we wrap up, a couple of things we want to make sure we always conclude with in that final session. You want to always end on a positive note. End each session on a positive note. You want to reassure the person that you're working with that they are cared for, that they are supported, and that they do have value and significance and worth. You want to always commend them on making great use and positive use of their telebehavioral health sessions. And most importantly, you want to thank people. Thank them for the opportunity to support their personal growth and development. These are elements that can be mentioned at different aspects throughout the therapeutic experience, but we want to make sure that we mention these when we're terminating and moving towards that final session. And last, we want to make sure that we always provide resources, resource information to where an individual knows where they can call to get additional support, to get whatever help that they need. And just for the purposes of this program, because I've emphasized a lot as it relates to behavioral health and looking at the mental health element, but also the substance use element, people need to always know where they can call to get help. And I listed 211, which is a hotline number where anyone can call and get resource information for their respective area. And it really doesn't matter what type of information they need. You can dial 211. It's a 24-hour a day, 7 days a week hotline number, and the very first thing that they ask you is, what is your zip code? You tell them what your zip code is, and then they will begin to identify whatever resources are available in your respective zip code. So I listed 211 in the middle, but I want to make equal reference to the National Suicide Prevention Lifeline. We tend to always make sure that that prevention lifeline number is available and accessible, so that whenever an individual is having some type of mental health emergency or they are experiencing suicidal ideations, they have access to the National Suicide Prevention Hotline, but also to the last helpline resource that I want to mention that is of equal importance as well is the 24/7 addiction helpline number. There are a lot of individuals out there who are in need of assistance and support when it comes to minimizing and ceasing their alcohol and drug use, and they don't always know what to do. So that addiction helpline number is available for them to access. So as a licensed therapist and a service provider, one thing that I try to make sure that I do personally is maintain all of those different helpline numbers in my personal cell phone as well as my work cell phone, because you never know when you're going to come in contact with someone who is in need. And it doesn't always have to be a constituent, a patient, or a client. Sometimes we have coworkers that need information. Sometimes we have friends that need information as well. And we want to make sure that this information is readily available and readily accessible. And so I encourage those of you who are considering providing telebehavioral health services, when you move to a place of termination, encourage the people that you're working with to store these hotline numbers in their phone where they are easily accessible and they can make contact if needed. So I want to just thank Alabama Department of Public Health and viewers for interest in participating and being a part of this telebehavioral health series. I often like to make sure I emphasize the fact that I did not make this stuff up. I referenced and reviewed numerous sources, and those sources are listed in your slides, and want to encourage you to access as many of those as you can to get additional information. I want to specifically emphasize the SAMHSA website, Substance Abuse Mental Health Services Association website, because you can find all of the different screening tools, additional screening tools, and other information on the SAMHSA website as well. So please feel free to access that information and learn more about what is available. And if there are any questions or you'd like to have further discussions or just start the conversation about telebehavioral health, this is my contact information. I'd be more than happy to have those discussions with you and support the conversations at your respective agency. And thanks again for this opportunity to share this information.
Thank you, Elena. This concludes our program for today. I want to thank Elena for being here and thank you for watching. Please remember that you can refer back to the training and resources anytime on demand. Have a great day.